Dr. Crayle, let's please talk about missing teeth. Lots of patients, and I'm one of them at least, have had it that way. We have missing teeth, usually in the back, because when we have a missing tooth in front, we run to a dentist relatively fast, but in the back, they don't seem to be bothering us, those missing teeth. We have 2, 3, 4 or more missing, and we go about it for years. Apparently no major side effect. Yet, you dentists keep telling us you got to replace those teeth, otherwise all hell breaks loose. Shade a little bit of light on what all hell really is. Why is there such a discrepancy of what we feel and how you think we should be getting treated?
Well, we see the problems that occur when people do not replace teeth. Now, sometimes if people don't replace teeth, well, the only problem is that they may have a little gap in the back, and the teeth may be stable, and some people can get by with that. But more often than not, over time, the teeth will tend to shift and move around if they don't all line up just so. If they have spaces to move, they'll tend to move toward those spaces. As they do, they tend to tilt over and twist around. The bite changes, and then hygiene becomes more of a problem, and ending up with decay or gum diseases or bad bite that can cause other problems. It's kind of a cascade snowball effect.
Well, tell us some of those, you said the bite. First of all, what does that mean? Is that a misalignment of the mouth, of the jaw? We have those 2 hinges here. They're called TMJ.
Yes.
I cannot pronounce the real long word for it. It's way too difficult for me. But to me, those are just hinges, being a mechanical machinery engineer. But is that what you mean by a bad bite? Things don't fit. You start grinding or whatever it is. And again, tell us, what are some of those other problems? Because when we hear you guys saying other problems can occur, well, we go, okay, well, what are the problems? So give us some specifics here.
Okay. Well, okay, it can show up as perhaps biting of the cheek or the tongue. It can show up as,
that hurts. That's not
yes,
good.
It can show up as gum infection. It can show up as sore teeth. As the bite shifts, there can create interferences like you're grinding your gears between your upper and lower teeth. They don't mesh together as well. And that can also lead to muscle imbalances in the jaw, joint imbalances, headaches, and these kinds of things.
Well, I can see. So basically what you're saying, again, coming from a machinery engineering background, so if you have cogwheels out of alignment, that whole machine starts grinding and eventually comes to a halt. So you said muscle imbalances. Basically, because of it, the muscles get tense, so now you get headaches because, the head, maybe the neck and the shoulder also starts having to make adjustments for what's wrong here. A little bit like on the foot.
Right.
When you have an imbalanced foot, like turned out or turned inside or shorter or something, it comes up to the knee. Next thing you need a knee operation when it really was your foot below. And you might even need hip operation, and it may, of course, go to the head. We know that. So what you're saying is the same way it goes from here down.
Yes. And sometimes people will come in, they have a toothache, or a loose tooth, and they're concerned, they think they have abscess infection, that they're going to lose a tooth, when in fact, sometimes all it needs is to adjust the bite, and then they can get better, and that's all it needs.
Wow. So would you say that, let's say a person had headache, shoulder pain, back pain a little bit, neck pain, kind of stiffness or whatever, not necessarily super severe, but whatever, has it there, maybe even severe, has tried a chiropractor or 2, has tried a few little things, and it seems to be there. And he has tried a few different billows, because gotta be something. Would it be wise for that guy, regardless whether he has missing teeth? Because I assume some of that stuff can happen even if you don't have missing teeth. Like you get hit in the car in the back, the backlash. Everybody just checks the neck, but maybe the hinges here are out of aligned. So would it be wise for a guy to go and say, let's go to a dentist who checks my bite, and maybe it is something, maybe it isn't. You eliminate
Yes.
it or you fix it. Would it be a wise thing to do for a guy with headache, shoulder pain, and neck pain?
Yes, that's a good thing to check it out, because oftentimes it is related to the bite and the way the function of the jaw occurs.
All right.
Yes.
Well, that's
Yes.
good. That's a good thing to know. I mean, if it wasn't done, if it wasn't anything which contributed, well, at least he knows, and then he can keep looking for other causes.
Yes.
And if it was something, you guys can fix it, right?
Yes. We can do a bite adjustments, or we have a bite guard that we can do, and it's now been approved by the FDA for treatment of headaches.
Beautiful. Because headaches, I mean, imagine, and I'm sure I don't need to tell you, but, people who have headaches, shoulder pain, neck pain, even if it's ever so slight, it is inconvenient throughout the day. I'm one of the lucky individuals who doesn't really know what a headache means, except when I don't drink enough water. But rather than that, no. But if it is there, it's bad. And I know lots of people around me, and they're just not as productive and as full of life. So this is wonderful. I appreciate your candid information here, and definitely very informative information. Thank you very much, Dr. Crayle.
Thank you. It's been a pleasure.